too late to vaccinate. Take your child to the nearest clinic as soon as possible and catch up, unless there is some contraindication to that.
Okay, it's never too late to vaccinate. But it doesn't mean if the kid is meant to have it at 3 months, for example, when you're 13. You know, I mean, is that too late?
It depends on the organism that the child is supposed to be vaccinated against.
All right. Last week we spoke about cervical cancer. There is a vaccine, right?
Yes, there is a vaccine to the HPV virus, which I think it contains 4 strains of the HPV virus, and 2 of those strains are the common strains which causes cervical cancer in South Africa. And this vaccine will be introduced, or has been introduced into the school campaigns for vaccination to be given to girls.
My studio guest tonight on Medical Monday is a clinical pathologist, and she's really on top of her game, let me tell you, because here's a chance for you to call in and just get some advice from my studio guest, Dr. Suvarna Buldeo, and she's here till 8 o'clock. We're talking about vaccines and vaccinations. Now, the story of vaccines did not begin with the first vaccine, Edward Jenner's use of material from cowpox to provide protection against smallpox. It rather can be traced way back. I think the Chinese, up until 1000 BC, there have been stories written that they were using some type of vaccine. And evidence also exists that here in Africa and in parts of Turkey it was also practiced before it spread then through Europe and America. So mankind, humans, you know, we've kind of known for thousands of years that there is some benefit in the science of vaccination.
Yes. So unfortunately, the medical textbooks only go back to Edward Jenner and his story, so I'm not familiar with the Chinese versions and all of that. But yes, and I think that's the way medicine progresses. You learn from nature. And that's what vaccination has taught us as well, because vaccination basically mimics natural infection.
So are all vaccines safe in general?
In general, because they have to undergo very stringent testing before they become available to the public.
But they do come with some side effects, right?
Yes, so local side effects are not infrequent, and that would be a blister at the site of the injection, or a small or some pain, burning sensation at the site of the infection. Fewer people would get a fever, like with the measles vaccine. Some children actually develop rash a few days later. So there are side effects to vaccines, but it's always to outweigh the benefits versus the risk.
So what are the risks and benefits then?
So the risk of getting measles and having a high mortality rate, it definitely does not compare to the risk of a mild fever or a controlled rash.
So there should really be little to no reason why someone would be scared by conspiracy theories or misinformation that vaccines and the vaccination program could lead to poor health.
Absolutely, because remember all the stringent testing that these vaccines undergo before they are implemented into the public domain. And obviously there are very rare instances, and there are specific patient groups where certain vaccines are contraindicated.
Like?
So, for example, patients with primary immune deficiency, and of interest, this week is also Primary Immune Deficiency Awareness Week. So these are rare genetic disorders where people have defects in their immune system, and these kids actually should not be given some of the live vaccines. So vaccines, we have live vaccines, and then we have subunit or partial vaccines. So they should not be given the live vaccines.
Okay.
And then there's some patients that are allergic to certain components in a vaccine. For example, the one that most people are aware of is egg allergy. So some vaccines previously have been manufactured within chicken embryos, and if somebody is allergic to egg, that by receiving that vaccine they can have an allergic reaction.